I am Dr. Bindu Menon, Senior Consultant Neurologist at Apollo Specialty Hospitals, Nellore. 4.5 hours. Let us know the importance of 4.5 hours in stroke. Stroke is a medical emergency. There are two types of stroke. One is an ischemic stroke and one is a hemorrhagic stroke. Ischemic stroke occurs when the blood supply to the brain is cut off due to a clot or a fat particle in the blood vessel. And the hemorrhagic stroke occurs when the blood vessel suddenly bursts. It could be due to sudden accelerated hypertension. What is this 4.5 hours? In cases of ischemic stroke, if the patient or the relative identifies the symptoms of stroke and takes the patient to the nearby hospital which has a CT scan or an MRI facility, and also who are well equipped in doing thrombolytic therapy, that is tissue plasminogen activator, most of the patients can come out of the stroke disorder. How does one recognize that they have a stroke? That is FAST. The World Health Organization has given a mnemonic that is FAST, F-A-S-T. F is for face. If there is a sudden onset of facial deviation, if one is talking and the face is deviated to one side. Arm, if the person keeps his hands in this way and the hand droops down on one side. S is for speech, when the person is not able to talk, the person is not able to understand, or the patient talks in an abnormal manner. And T is time. Time is brain. That is that 4.5 hours. The other symptoms are sudden onset of very severe headache, sudden onset of giddiness, sudden onset of walking difficulty, sudden onset of visual disturbance, sudden visual cutoff on one side, or sudden onset of swallowing difficulty. All these symptoms, if a person experiences, the relatives or the bystander needs to take this patient to the nearby hospital. What is this 4.5 hours? If the patient is taken fast, as soon as the blood supply to the brain is cut off, there are millions of cells which are dying within seconds. So you need to burst the clot which is in the blood vessel, and that is known as thrombolytic therapy. So you are trying to decrease the damage to the brain. That is that 4.5 hours. You need to identify the symptoms of stroke. You need to be stroke aware and you need to be stroke smart.